The Image of Nursing by Liz Anderson Fitzgerald, Melanie Hecker, and Shelley Miller. During this presentation, we are going to explore the different images that nurses have went through from the 1800s to the present time. During the 1800s, most nurses around the world were of low class in the profession and society, but felt like they were doing their civic duty to help others. There was no formal nurses training until 1836, and the first nursing school was founded in Germany. Since many nursing schools were not established, many nurses were untrained and were not part of the working class. This picture is a portrayal of a nurse from the early 1800s. She is very plain clothed, and there is no specific indication that she is a nurse or a care provider. Florence Nightingale was a pivotal part of changing the image of nursing. She was able to formalize nursing education, she stressed the importance of cleanliness, and she established the standards of basic necessities such as bathing, clean clothes, clean dressings, and adequate nutrition. Florence Nightingale changed the way nurses were viewed. She was able to show leadership during times of great stress, especially during the Crimean War. Originally, the hospital that she went to was the Barrack Hospital, and she was able to decrease the mortality rate. She focused on eliminating diet problems, dirt problems, and drain problems. Therefore, she combated these problems by providing clean supplies, adequate nutrition, and clean linens, as well as stressing the importance of hygiene to others. Florence even wrote a book titled Note on Nursing, What It Is and What It Is Not. This book provided direction on how to medically manage the sick. During the 1800s, nurses did not have as many responsibilities or tools as they do today. Nurses utilized compassion and their ability to care when working with patients, especially during times of war. Nurses helped patients to write home to their families, and they also comforted those who were dying or helped use palliative care to care for these patients. During the Civil War, nurses took on more responsibilities by assisting surgeons with operations. They also started to administer more medications. At this time, there was about 100 different medications as compared to the over 13,000 that we have today. During the 1800s, nurses took on new roles as they saw fit. They had to utilize the resources that they had around them since there was no general policies and procedures or general goods that they could buy. One nurse who embodies this is Helen Gilson. During the Civil War, she was able to use everyday items to dress wounds, and she was also able to accommodate soldiers with special dietary needs. Since there was no conventional nurses training that was universal for the world, nurses had to learn how to care for patients when and where they could. For example, Clara Barton, the founder of the American Red Cross, learned how to be a nurse through treating her family, including applying leeches to her brother to bleed him while he was injured. Hospitals became more prevalent at the close of the 19th century, especially in urban and industrialized areas. Nurses started to work in hospitals instead of the home. The roles and efficacy of nurses varied between hospitals, and there was no uniform way of nursing or training. In 1910, Florence Nightingale passed away, but it did not change the effect she had on nursing. Ads featuring nurses were common in the early 1900s to advertise home remedies. During the war, nurses were often in the battlefields taking care of soldiers who were injured. During the 1920s, when the women's rights movement gained momentum, women were granted the right to vote. Women had been in nursing positions for many decades, but the right to vote was a change in the rights of all women. This is a photo of a maternity ward during the 1920s. In the early 1930s, there was rumors of a nursing shortage after the financial hardships of the Great Depression. During the 1930s, increased hospital usage, changes in hospital construction, more technologically complex patient care requirements, and a reduction in the working hours for nurses all necessitated an increased number of nurses to deliver bedside care. The nursing shortage that started in the 1930s was devastated even further during the 1940s due to World War II. Many ads were put out in hopes of encouraging individuals to become a nurse during the nursing shortages. During World War II, the armed forces ran ads to recruit more nurses to help serve the troops. During World War II, there was a change in the way nurses and volunteers were utilized. Many nurses and volunteers could be found on the front lines of the battlefields helping soldiers. By the end of World War II, 77,000 nurses had joined the military services. Therefore, there was not as many nurses to care for civilians. In the 1950s, the average work week was 48 hours compared to the 38 to 40 it is currently. During the 1960s, this was a time that nurses took tedious measures to ensure everything was clean and sterile before the time of disposable devices. During the 1970s, medical progress continued with advances such as increasing use of endoscopies and the development of CT scans. Transplant surgery was also becoming more successful and ICUs were now widespread, as was kidney dialysis. In the 1980s, nurses lived by Cardex, a folded cardstock hand guide to all things for the patient, completed in pencil and continuously crossed out or erased and updated. The 1980s saw the end of the nursing caps altogether. Nurses also began wearing disposable aprons at this point rather than cloth aprons. In the 1990s, the use of Cardex was still in place, but the medical field was moving forward quickly. The advancement of equipment has been ever-changing since the beginning of time. Nurses' roles have been ever-changing as well. The one thing that had never changed from 1900 to 1990 was the need for nurses to provide bedside care to patients of all walks of life. Technology has advanced greatly over time. The use of robotic surgery and robot-assisted surgery, as well as other different types of technology utilized within the healthcare setting, have helped increase precision, flexibility, and control than is possible with conventional techniques. The use of crash carts has become more sophisticated over time due to the technological advances. The defibrillators are more high-tech, as well as the medications within the drawer are better organized and individually stocked. The Pyxis MedStation automated medication dispensing system supports decentralized medication management with various features for safety and efficiency. The system helps accurately dispense medication while supporting pharmacy workflows. The eICU program clinically transformed the ICU using proactive care model that provides a solution to growing physician and nurse shortages while dramatically improving quality of care. Through an ideal blend of medicine with technology, this care model leverages clinical expertise, patented processes, and cutting-edge technologies to improve critical care delivery. The Alaris pump module is a large volume infusion pump that helps continuously or intermittently deliver fluids, medications, blood, and blood products to adults, pediatrics, and neonatal patients. Clinicians can attach up to 4 IV infusion modules, allowing 4 independent infusions on a single PC unit. In conclusion, the image of nursing has changed greatly since the 19th century due to technological advancements, but compassionate ability to care for patients has stayed the same and adapted over time.